very few. And last time it was purely, gynecological oriented. Okay, now it is going to be a general topic. And Madam is a very senior professor at the GSL Medical College. And she is going to give you a lot of useful information. And it is going to be a very useful session.
What happens in the body regarding that particular cancer, we don't know how to treat it. Now we have come to such a stage that we can prevent many cancers. Okay. Last time also I have told to certain girls and boys, certain cancers are preventable completely. There is a vaccine for certain cancers. So how far the human, but they should go to their doctor and get the breast examination. And if they are 40 years plus, they have to do a mammogram. Mammography is nothing but X-ray wherein the breast is examined. Next. So early detection saves life. So today you have to learn is some cancers can be detected early, can be prevented. There are certain vaccinations because early detection downstages the cancer. Downstage అంటే treatment ఇంట్లో ఎవరికైనా పేరెంట్ కానీ మేనత్తకి కానీ బ్రెస్ట్ క్యాన్సర్ ఉంటే మనకు వచ్చే అవకాశం ఉంటుంది. అండ్ జెనెటికలీ BRCA జీన్ ఉన్న వాళ్ళకి బ్రెస్ట్ క్యాన్సర్ వచ్చే అవకాశం ఉంది. సో ప్రివెన్షన్.
Good morning everyone, I'm K. Renita, a 5th year pharmacy student from GSL Hospital. Today on the occasion of National Cancer Awareness Day, we come together to break the misconceptions and promote knowledge. So let's know about some common myths and facts about cancer. Many people think that cancer is a death sentence, but the fact is with early diagnosis, screening programs and advanced treatments like targeted therapy and immunotherapy, many cancers today are highly treatable. Cancer is contagious. But the fact is that you cannot catch cancer by touch or sharing things. But however, viruses like HPV and hepatitis B can increase the cancer risk, which is why the vaccination is very important. Only older adults get cancer. No, the fact is that young people can also get cancer due to genetics, lifestyle factors and infections. Never ignore symptoms like unexplained weight loss, lumps, bleeding or persistent fatigue. Sugar feeds cancer. But the fact is that cancer cells use glucose just like normal cells. Eliminating sugar does not cure cancer. However, excessive sugar can cause obesity, and obesity increases the cancer risk. Biopsies or surgeries spread cancer, but the fact is that the modern procedures are safe and essential for correct diagnosis. Delaying them can worsen the outcomes. Remember, nearly 30 to 50% cancers are preventable. Early detection, awareness and timely medical care can save lives. So let's replace fear with science, support and action.
Greetings of the day. Myself S. Harshavardhani, studying 4th Pharmacy in GSL Pharmacy. Today I am here to say about breast cancer. As we all know that cancer is an uncontrolled cell division which may lead to uncontrolled cell growth. If this happens near breast or in breast tissues, this may lead to breast cancer. The formation of a tumor which can also lead to breast cancer. This is mainly caused due to advancing age or mutated genes like BRCA1 and BRCA2 genes. And there are other factors which can also lead to breast cancer are family history, hormonal replacement therapies or any early menarche stages. There are different types of stages in breast cancer: early breast cancer, locally advanced breast cancer and metastatic breast cancer. Local lesion breast cancer can be early, predictable and can be cured easily. But metastatic breast cancer are uncontrolled and they are uncurable. A painless lump formation in your breast is an initial stage or an initial sign for the woman they are experiencing breast cancer. In metastatic breast cancer, skin edema, warmth, redness of the skin are the signs and symptoms of breast cancer. These are all diagnosed by physical examination, 3D dimensional mammographs or MRI or ultrasound radiations. Surgeries, radiation therapy, systemic treatment like hormonal therapy, targeted therapy, chemotherapy and immunotherapy are the treatment options for breast cancer. Thank you.
Hi everyone, this is Suchitra from 5th year PharmD. Every year, millions of people hear 3 painful words. That is, you have cancer. Some people break down, some fight back and some never even get the chance because awareness came too late. We people smoke, we drink, we skip health checkups, we ignore small symptoms. A small test, a small checkup, an early visit to the doctor can save a life. That one life could be yours. or your mothers or your friends. So from today, let's promise no tobacco, no delay in health checkups, eat healthy, stay active and speak openly. To all the survivors with cancer, you are warriors. To all the fighters, we stand with you. And to everyone here, spread this message. Thank you.
Good morning everyone, myself Madhumita from 3rd B Form. Today I want to tell about cervical cancer. Cervical cancer is the most effective common cancer in every woman. Cervical cancer develops in the lower part of the uterus due to the human papilloma virus infection HPV. The good news is early detection can save so many lives. Regular screening tests and HPV vaccination are the major and powerful tools for cervical cancer prevention. Sadly, every woman is ignoring early symptoms like unusual bleeding and pelvic pain. Let's remember, prevention is better than cure. So, let's make every woman to encourage and maintain their reproductive health and tell them to take the HPV vaccination and make them to secure from this cervical cancer. Together through awareness and actions, we can come close to this. We can come close to the world free from cervical cancer. To the all women out there, I got vaccinated. Now it's your turn. Thank you.
Hi everyone, I am B. Devdipya studying 5th PharmD in Guide School of Pharmacy. Today, National Cancer Awareness Day. As I want to talk about the silent killer, lung cancer. Every year, millions of people around the world dies due to this disease. But many of them don't realize that it can only affect the smokers, but it affects the second-hand smokers and who expose it to the air pollution. But what many doesn't realize is that it affects only smokers, but it affects who expose it to the air pollution and second-hand smokers. Common signs include a persistent cough, chest pain, shortness of breath and unexplained fatigue. The good news, it can be prevented and treated if detected early. So take care of your lungs by quit smoking, avoid polluted air, get regular health checkups. Your lungs give your life, protect them. Let's spread awareness, support those fighting cancer and remember, together we can breathe life again.
Hello everyone, I'm Kona Ramlakshmi, currently pursuing 4th year of Doctor of Pharmacy in Guide School of Pharmacy. Today I want to talk about liver cancer. Prior to that, we have to know what liver is. Liver is an organ that usually present in the upper part of the abdomen. It usually detoxifies the blood of a body. First, we have to know what causes liver cancer. Liver cancer usually occurs due to the long-term damage of the liver. It also includes alcohol consumption, smoking. How do we prevent liver cancer? Limit alcohol intake, quit smoking, maintain a healthy diet, vaccinations are available for hepatitis, and lastly, regular liver checkups are very helpful. Thank you.
Hello everyone. So, good evening to all.
Good evening, sister.
So, myself Joyce Nelson and I am from PharmD, Guide School of Pharmacy nunchi vachanu. So, I am here to aware you guys as November 7th is known as National Cancer Awareness Day. So, what you guys know about cancer? Anyone?